Today in this video, I want to talk to you briefly about the bevel. Here I have set up 3 needles. This one is a 21 gauge, this is a 22 gauge, and this is a 23 gauge. It's a butterfly. I've removed the covering so the needle is showing because I want to show you the bevel. This is the 21 gauge, and here's what the bevel looks like. This is the 22, and this is what the bevel looks like. You will notice that the bevel or the needle is smaller than the 21 gauge, and here's the 23 gauge. It's even smaller than the 22. Now we're going to talk about the bevel. When you're drawing blood, it's very important that the bevel, which is this right there, the hole, this nicely cut end of the needle is the bevel. You want to make sure that every time you're drawing blood, the bevel is upward. Now, there are different needles. For example, you have the butterfly. This is how it looks. Okay, you have, this is the 22 gauge. This is how it looks. They are different, obviously. The 22 gauge has this safety mechanism, which is kind of long. The 23 gauge does have a safety mechanism, but it's different. Now, what I want to draw your attention to is to find something on the needle that will help you in ensuring that the bevel is up. So for the 22 gauge, if you pay attention to the safety mechanism, once the safety mechanism, which is this, is upward, your bevel is going to be up. But if the safety mechanism, which is this, is downward, then your bevel is going to be down. So if you're using a needle like this one, always make sure that the safety mechanism is up. And once you do that, the bevel is going to be up. For the butterfly needle, you want to make sure these are the flaps. You want to make sure it's like this. It's flat on the flaps. Once you make sure it's this way, then the bevel is going to be up. If it's the other way, then the bevel is down, which is not what you want. There are other types of needles, so I only have 2 now. But if you can take some time and look at the needles that you're using to draw blood, try to find something that can help you in ensuring that the bevel is always up. Now, why does the bevel needs to be up? It needs to be up because when you're inserting the needle into the patient's vein, having the bevel up will ensure that you get blood. If it's downward, after you insert that needle into the vein, you're not going to get any blood, and you won't be able to feel any collection tube. So you must ensure that the bevel is up. This is the proper way to insert a needle into a patient's vein. The bevel must be up, not on the side, not downward, but upward. And you also have to make sure that all of the bevel has entered the vein. If half of it is in the vein and the other half is outside, you might have problems. Blood might not flow properly. You might not get no blood. Maybe you might get some blood, but it might be slow. So you want to make sure that all of the bevel has entered into the vein. Okay, guys, so I hope this was helpful. If you like this kind of video, give it a thumbs up. I thank you guys for watching. Have a good day.